I am presenting a case of male 16 who come to me with decreased hearing, otalgia or tinnitus on the right side. He has history of slap by his father because of not studying properly. So this is having tympanic membrane perforation due to trauma by slap, and this trauma lead to this otalgia, tinnitus or decreased hearing. Etiology of traumatic perforation are direct trauma or indirect trauma. Direct trauma are foreign body insertion, slap injury, penetrating trauma. Indirect trauma are sudden pressure changes like scuba diving, blast injury, acoustic trauma. These are the two common etiology, direct trauma or indirect trauma. Incidence male versus female. Male is commonly affected about 60%, female is 40%. It's common on the left side. Common causes of male traumatic perforation because of higher involvement in physical fight, greater exposure to occupational hazard, and more participation in high risk sports. Most commonly affected quadrant of tympanic membrane is posterior inferior quadrant because of structural weakness, slap injury pressure directly on this site, and foreign body trauma, which is most accessible part of the tympanic membrane. Most common clinical presentation is ear pain, hearing loss, tinnitus, sometime vertigo is also there. Diagnosis mainly otoscopy. You can see there is irregular margin traumatic perforation is there, showing traumatic sign like blackening and reddish. Tuning fork test showing Weber lateralized to the affected side. Pure tone audiometry showing 40 decibel hearing. This case it depends on the size of the perforation and sometimes required tympanometry. For medical legal purpose, you require audiometry. Management mainly conservative. You have to keep ear dry, avoid ear manipulation, antibiotic ear drop if infection is there, and follow up to 8 weeks. Most of the ear perforation heals spontaneously in about 80 to 90% of cases if perforation size is less than 50% of the tympanic membrane diameter. If perforation diameter is more than 50% of the tympanic membrane, then you require tympanoplasty. Prognosis is very good in a small perforation. Large perforation sometimes required this tympanoplasty. Complication mainly chronic perforation, recurrent infection, persistent conductive hearing loss, ossicular disruption, or cholesteatoma formation. You can prevent these by the avoiding inserting object into the ear. You use protective earplugs for high noise environment area, and you have to equalize pressure during diving and or flying. On conclusion, most traumatic perforation heal spontaneously. Proper care and follow prevent complications. Surgery is required only for persistent perforation or complication cases.